I remember you. You left my spirit with you high is all I'm feeling.
Hello YouTubians, Curt here again. So tonight I have a special subject that I would like to speak to you about. And this is mostly for the older adults who have aging family members, most especially our parents. This is about a very dear coworker of mine who has always had a special place in my heart because he is this like spectacular person who's down to earth, very likable. Everybody loves him. Can't say enough good about him. I'll call him Mr. P, which is nowhere near his name. But I come into work today and I find out, I'm like, hey, Mr. P, how you doing today? And he's always very friendly, very forthcoming. We talk and grin, things like that. And he opened up to me, which kind of surprised me, that his father wasn't doing so well. I started with, hey, how's your weekend? Oh, it wasn't so good. So it wasn't like he was like looking for a chance to come out. It's, as I've said in my other videos, if you don't want to know, don't ask. And so I do want to know. I truly care about people. I care about my students. I care about my coworkers, and I do ask. And I'll talk about anything and everything under the sun. And I said, so how's your weekend? Oh, not so good. Oh, what's going on? My dad has had 3 strokes in a row. Now, being in medicine for 23 years, I have some knowledge on this. Secondly, I'm certified through the state of Colorado to be a director of an assisted living home. And that's where you would take mom or dad when they start forgetting how, they start forgetting to take their meds. They just need some help in life, mostly they can walk around on their own. They can't drive anymore, prepare meals for them, do their laundry for them, do all the house stuff for them in the twilight years of their life. And they can sit and watch TV. And I learned a lot in running an assisted living, because all the things that you think they want to do, you're totally wrong about. You think they want to get out and play and all this stuff. And man, they've been doing that for years. They're in their 80s or 90s, and it's like, dude, you're 30 or 40 years old, maybe 50 years old, and they got 40 years on you, which is quite a while. But this video is to discuss hospice care. So let's say one of your parents, and this is usually, mom's gone or dad's gone and the other one's still alive, and then their health starts deteriorating. It's really popular to have TIAs, which are transient ischemic attacks, which are like mini strokes, tiny little strokes. They forget things, they can become dizzy, they can fall over. And a lot of times you hear about our elderly population having a fall and you don't know where it came from. A lot of people just think, oh, I watch dad or I watch mom walk all the time. And man, they're just not that sure-footed anymore. And they fell and they sat there for 5 or 6 hours or 10 hours before somebody discovered them. And now we have to go in, they have a broken hip. They're going to spend time in the hospital, and then the hospital will send them to some kind of a care facility, sometimes home, if you have that kind of support at home. And nobody really delves into what caused the fall, because they usually don't remember, because in a good amount of the times, it was due to a transient ischemic attack where they suffered a mini stroke, they got dizzy or passed out and fell, and then this microclot, blood clot in the brain passed along, and they're no worse for the wear. And it's my personal opinion that we start suffering these at 40 years old and such. You suffer them during your sleep. You don't have to be doing heavy cardio running 20 miles. It just happens. And that's why blood thinners are so prevalent in our society, is the medical profession does realize how common they are. So let's say they start having TIAs, and Mr. P's dad, whom he's very close to, and he's been close to his whole life, his dad's been supportive of him his whole life, and it's wonderful to hear that. But he had 3 strokes over the weekend, one after the other, and it's left him more impaired than he was. He was already suffering from some dementia / Alzheimer's. Sometimes it's hard to tell which component is stronger. But then you suffer a stroke, and what happens in these cases is it shuts down part of the brain, and you try to speak, and imagine if you were speaking through a machine and everybody else hearing you heard garbled words. So if I say, hey, could you please go get me a Coke out of the fridge, other people might hear chair, dog, sofa, carpet, sometimes ice pop, whatever. And what you're hearing when you say this is what you're saying. Your brain knows what you're saying and says, yeah, you said, could you go get me a Coke out of the fridge? What came out of your mouth was something totally different, and you don't recognize it. And you get upset because you're trying to communicate with people, and they're looking at you like you're crazy, first of all. When your brain isn't crazy, it's just the portion that controls your speech is having difficulty. You have some wiring issues, basically. And so at first, it appears to be like somebody's messing with you. They're joking with you, whatever. And you're like, Dad, what are you saying? And so that's the first complication people have with their family members when this happens, is they try to argue with them or reason with them to tell them what's really going on, because you truly do want the person to understand what's going on. They're getting frustrated with you. They're getting angry. They have full arm paralysis on one side or both sides, or, limited movements. They definitely can't walk. And then you're sitting there telling them, Dad, I don't understand what you're saying, or Mom, you're talking crazy. And that's how we're used to talking to them, because they've been our mentors our whole lives and been taking care of us. And all of a sudden the roles are reversed. So as a recommendation, the whole purpose of this is to make some recommendations to you. Don't argue with them. Don't try to reason with them. It hurts their feelings and it makes them angry. Okay. Now it's okay to tell them, don't treat them stupid either. It's insulting. Don't talk to them like they're a 3-year-old. But simple things down. If they're having trouble with communication, make communications simple. They have what's called talk boards. It's a plexiglass board that has letters on it and stuff. And you hold it between you two. And so let's say yes is over here and no is over here. You say, Dad, would you like some popcorn? And he goes, you see his eyes move to that because you're sitting straight across from each other. Now, if every answer for yes is no, then you'll know to superimpose and take the no's as yeses, okay? It's a simple way to start communications with somebody who may have just lost some communicative abilities, okay? So that's one. The second thing is make communications as simple as possible. Yes, no answers. People can blink, people can nod, people can gesture with their head, things like that. Just be very sympathetic to the fact that, look, man, they want to talk to you in a succinct and clear voice and get what they're desiring. And this baloney that's going on in their head is not making them happy, not making you happy. So, excuse me, it's very late. I'm a yawner. I never get enough sleep. So, be sympathetic towards their needs, but don't be coddling to them too much either. That's especially with men who are used to being the father figure, the power figure, the alpha figure. They find that demeaning and very frustrating. So then let's move on to palliative care. And this is where a relative has had a severe fall. They're old enough or ill enough that modern medicine is unwilling to perform a hip surgery on them. Say they broke off the tip of their femur in a fall and they're not willing to pin it. They have osteoporosis. If they put pins in it, it won't hold, for whatever reason. Let's say the stroke is very damaging. When you have multiple strokes, it is just compounding the problem. And this is where the doctor says, usually to you as a family member, your mother only has 2 weeks to live or a month to live. And so they'll make recommendations for you. And this is where home hospice care or hospice care in an assisted living home is hugely beneficial, because these people are trained and they're so compassionate. I cannot tell you how compassionate they are. When I am dealing with hospice care, I become the most caring individual in the world. I will stay up 24 hours a day holding their hand, spoon feeding them, wiping their buttocks, doing anything that I can to make them comfortable. So with palliative care, the determination is made that we're going to stop all these heart medications and all this stuff, and they're going to go downhill quickly. Another huge part of palliative care is your physician will prescribe usually an oral morphine drug with open orders to give it as much as you want. And there's a reason for that. It's to provide your loved one with comfort. And we so often say, oh, I want them to be vibrant and alert and awake. I don't want them sleeping all the time. When I start giving them the morphine, they don't eat as much. Look, they're not eating as much as it is. We know that death is inevitable, and losing a loved one is just mind-numbingly painful and nerve-wracking, especially when it's your parent. You've known them your whole life and you're 50 to 60 years old and your parent is leaving you, and that's very hard. But think of them, think of their needs, and give them that oral medication as much as humanly possible. Whenever they're awake, give it to them. Let them go back to sleep. Let them rest. Don't expect, oh my goodness, I have to tell you this. Do not expect for their eyes to pop open the minute before they die and to unload upon you some grand epiphany that they've seen the other side and they've put all of their life into one sentence. If they could, they would have done so 20, 30 years ago and shared that with you. Don't expect that, or you're setting yourself up for heartbreak. It has happened. It does happen. I believe in miracles, okay, but I do not rely on miracles, okay? I rely on scientific evidence and things that will make our families feel better and relieve their pain and their angst and their nervousness. A lot of them are scared. What I've found is a lot of them are very accepting and really don't know the predicament that they're in. And that's okay. And family members don't know how to deal with it. And this is when siblings start to fight and all this stuff. And let me give you another word of advice. If you cannot discuss and not talk about mom and dad's home that you're now going to be responsible for, or which brother or sister is going to deal with that. I've got 6 kids in my family. Most of whom are much more responsible than me. And when my parents die, I'm going to have nothing to do with the whole property situation and jewelry and money and bank accounts. I don't care about any of that. I truly don't. I don't care if they give it all away. I don't care who gets it. If you're relying on somebody to die to give you a step up in life, be ready for a letdown. Okay, these are hard times and people are spending all their savings to make a living. So don't discuss that around mom or dad or whoever's sick. Don't, if their affairs aren't in order, if they're awake enough to discuss it and have it, enough in them to discuss it, fine. But have a witness to it, have a lawyer witness it, whatever. If they don't have a living will and testament or a last will and testament, you can, I guess, try to tackle the problem, but I've just seen so many families destroyed by people being grubby. Oh man, they moved mom into a home and now all of a sudden the sister or the brother is going to the house because they have a spare key, and they're starting to take things, and they're selling the big screen TV, and they're having appraisers come over, and mom and the families at the assisted living facility, and they know that everybody's going to be there for 4 hours, and so they have a person come over and assess the stuff for the estate sale and things like that. It's just horrible. Geez, let it go for a few weeks and discuss it, and don't be greedy. If you get something, you get something. If you don't, you don't. If you're that hard up where that stuff really means something to you, then that's time to have a heartfelt discussion with your brothers and sisters, relatives, and say, hey, look, I'm really hard up. I'm $20,000 down. I owe back taxes, yada, yada, yada. And rely on, your tightness as a family, however tight it is. My family by no means is not tight. I don't even know where some of my brothers and sisters live. Like, I know the state, I don't know their address, I don't know the city. We've just never been that close. But whatever. It's about the person who needs the care. Give them the support they need. A little tiny ice chip on a plastic spoon put into their mouth to relieve the dryness of their lips, so a moist washcloth on the lips. Take some they have lip cream that is made. It's not like chapstick, but it's a cream that you can put on their lips and make their lips feel comfortable. Little sponge bath around the face. Don't look at giving their whole body a sponge bath. Wherever they're at, they should smell relatively clean. Now, they're going to have certain body odors and stuff because they can't get up and get in the shower. Let me tell you, the elderly do not like taking showers. They are freezing their buns off. They have no body fat. Whereas you and I get up in the morning, we're like, oh, that shower that's going to waken us with that hot water. It's like, it seems you can't get it. It's either way too hot for them or way too cold for them. You can never find it just right. Especially when they're bedridden and stuff. So make sure the staff is taking care of their needs. And if they are, thank the staff. And for God's sakes, don't ride their butts. Because let me tell you, I have never in my life, never seen a staff member mistreating a patient. They give way more than you'll ever know. And if you do find a place that is not treating mom or dad right, then you get mom or dad out of there ASAP and you report it to the state. Don't be vicious and mean about it. Just make the report so the state can follow through with what they need to and let them handle it and move on. Take care of your family member first and foremost. Once that part is taken care of, that means their diapers are being changed and their buttocks are being cleaned very well daily, and the urine smell. There should be no urine smell. There should be no poop smell. If there is, did they just now have a bowel movement in their diaper? It's okay if that happens. It's just like a baby. You're not going to go saying somebody's a bad mom because you smell poop in the baby's diaper. Babies poop all the time. Mom and dad sometimes poop all the time when they're in that case, okay? So ensure that they're clean. They should never have a bed sore. Ever, 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 ever. That's a good sign. If mom or dad has a bed sore, move them out of the facility. So take care of them. Make sure their needs are being met. Give them the palliative care that they need. And if you know somebody who's in the situation, don't be a big bother to them, but offer them your help. It wouldn't hurt to cook a casserole and bring it to them because they're spending an extra 8 hours a day. People will do that. They'll go to work for 8 hours and then go 8 hours and spend them with mom or dad at their bedside. So it wouldn't hurt to deliver a casserole to their doorstep, things like that. I found that generally flowers and stuff, a waste of time. It would be, a small little, what helps is a plant that can be planted in, like here in Colorado. Give them a plant with a little stick in it that says, oh, this is such and such plant. It's a perennial, whatever. And then they can plant that somewhere around their house and they could always remember mom or dad through that plant. Put a little tree, a seedling on their doorstep with a note that says, hey, we're here for you. We thought you'd want this little apple tree so that every time it bears fruit, you'll remember mom or dad. The personalized touches matter. So I guess that's all I have to say about that. Feel free to make comments below If you have recommendations or you would like something answered that I haven't hit upon, I just wanted to hit upon the basics because just remember everybody's suffering. And as always, make them happy.